All right, good afternoon, everyone, and welcome. My name is Molly Vandervest, and I'm the president of the Bellin Health Foundation. We are so glad you're here, and we have some incredible news to share. It's an announcement that will truly transform mental health care in our region, and we can't wait to tell you about it. You might be wondering why we're in the Rush Expo space, and I will tell you it's a great tie-in, and the news we're about to share is going to impact our entire community and not just Emplify Health by Bellin or Marquette. Last week, I toured our new Children and Adolescent Center that's over on Ashland, and there's a sign in one of the stairwells that's almost 2 stories high, and it's a Helen Keller quote, and it says, "Alone we can do so little, together we can do so much." And I stood in front of that quote and I just thought about today because I knew this announcement was coming, and it's truly a partnership that we're announcing, and we couldn't have done it alone. So in that vein, I'm excited to be joined by representatives from Marquette University and the Richard J. Rush Foundation in this beautiful Rush Expo space. I'm thrilled about the partnership that brought us here today, and to tell you about it, it's my pleasure to first welcome our Emplify Health Executive VP and Bellin Region President, Chris Waleski.
Thanks, Molly. Thank you all so much for being here with us today. First, as a Marquette Law School alum, and also current member of the university's Board of Trustees, and also as president of Bellin Health, and someone who grew up in this area and really spent the entirety of my life here. This partnership is really close to my heart in so many ways. And what we've come together today to announce will have a profound impact on the mental health and the well-being of northeastern Wisconsin and the Upper Peninsula of Michigan for years to come. But before we get to that, I think it's important to set the stage for why this matters. I want you to understand what the need truly looks like and how we, in partnership, have the opportunity to make a difference. It is widely understood that we're dealing with a mental health crisis. In fact, Molly and I are wearing green because this is Mental Health Month. And in our region and our state and nationwide, it's a serious crisis. What does it look like? Well, according to the Centers for Disease Control and Prevention, more than 21% of adults receive mental health treatment. In young people, between 2016 and 2020, anxiety diagnosis grew by 29%, and depression increased by 27%. And a staggering 41.8% of Wisconsin youth who were depressed did not receive any care. It's estimated that 2.2 million of our state's residents don't have enough mental health services and professionals in their community. Increased demand for treatment has strained available providers and led to burnout across the profession. Everyone wants to meet the need, and when you can't, it's devastating. And according to the Wisconsin Department of Workforce Development, Northeast Wisconsin will need about 500 more non-psychiatric mental health professionals by 2028. That's less than 3 short years away. The numbers alone are stark, but we also know there are significant barriers to training more mental health professionals. Time and cost are major challenges. Students may be juggling work, family, internships, just to stay in school and finish their training while making ends meet. Most therapy providers are master's prepared, meaning they need to get a master's degree in counseling, and they need 3,000 hours of supervised training after they graduate. Those hours are tough to come by. Workload demand is already high on the existing working therapists and professionals. Supervision reduces their billable hours, and existing providers may not feel comfortable supervising recent grads. It's such a challenge that far too many promising therapists never reach their 3,000 hours and never get to contribute to the extreme mental health needs that we face. It's a daunting problem, to say the least. A dire need for mental health services means a dire need for more mental health professionals. And yet, these promising students and recent grads face such significant barriers that many give up entirely. Well, we've been long aware of these problems, but we couldn't solve them on our own. And then, an innovative partnership idea developed by my alma mater, Marquette University, was presented to us. We talked about that idea as well as to describe this exciting initiative. I want to welcome Scott Durso, Marquette University Acting Vice Provost for Graduate and Professional Studies and Dean of the Graduate School, and Alan Burkhardt, Professor of Counseling Psychology and Chair of the Counselor Education and Counseling Psychology Department at Marquette University. Oh, that's a mouthful. I want to invite the two of you up here to share more about the program.
Thank you, Chris. I know it's a mouthful every day. I'm happy to be here today on behalf of Marquette University. Marquette is committed to developing the next generation of scholars, researchers, and professionals with exceptional programs to meet the needs for master's level degree seekers. Noting the shortage of mental and behavioral health practitioners in Northeast Wisconsin, Marquette reached out to Emplify Health by Bellin to explore ways in which Marquette's CACREP accredited clinical mental health counseling program could help meet this significant need. We are honored that the Richard J. Resch Foundation and Emplify Health by Bellin saw the value in this partnership and helped Marquette to develop this multi-year pilot that provides graduate degrees on the way to licensure to help break down structural barriers to keep behavioral mental health practitioners in Northeast Wisconsin. We see both the value of this initiative for those in need of behavioral mental health services in Northeast Wisconsin, but also the talent pipeline in the area for those serving that need. This initiative underscores Marquette's Ignatian values of developing people for and with others, and it aligns with Marquette's Catholic Jesuit mission. I'm pleased to be here today with Alan Burkhardt, who will describe the Resch Mental Health Initiative, which will welcome its first cohort this fall, thanks to the incredible generosity of the Richard J. Resch Foundation.
Thank you, Scott. Hello, everyone. I'm really delighted to be here. I want to look around and just take this in for a moment because this is really incredible. And I'm going to share a few details of what I consider a really remarkable and innovative collaboration. This project began several years ago with a few simple questions. We went to Emplify Health by Bellin, with asking specifically about the primary concerns for the residents in this area. And then the second thing that we asked is, how can we help with those concerns? And as a result of those discussions, I'm going to outline some of the details of what we're going to do with this particular project. There are two phases in this project. The first phase is the graduate program itself, and we seek to enroll students in Northeast Wisconsin in our clinical mental health counseling program, which is a 2-year, 60-credit program. Students from this area are eligible to apply for a scholarship, which will provide full tuition and stipend support, ensuring that students don't experience any financial barriers while they're pursuing their education. These students will be known as Resch Scholars. In addition to the educational programs, students will also complete clinical training, which will include practicum and internship experiences. These experiences will occur with Emplify Health by Bellin at various locations in Northeast Wisconsin. These hands-on clinical experiences will be supervised by Emplify clinicians to meet the growing demand for mental health services in this region. Additionally, students will be afforded dedicated mentorship and professional development opportunities, ensuring that they're supported and prepared to meet the licensing or the increasing demands for mental health services in this area. This program will also offer training to current Emplify clinicians on the practice of clinical supervision. So we're hoping to prepare those clinicians to really support the students. In the next phase of the program, which will be known as Resch Fellows, and upon graduation from our graduate program, program graduates will be offered the opportunity to become full-time employees of Emplify. Here, fellows will become licensed professional counselors in training and work towards completing the 3,000 hours that are necessary to become a licensed professional counselor. After completion of the fellowship program, fellows will have the opportunity to continue employment with Emplify Health by Bellin as a fully licensed professional counselor. A key element of this postgraduate opportunity is some additional incentives, particularly around signing bonuses and retention bonuses, which will further support the retention of these professionals as they continue their training and commitment to the region. This program will be a true game changer, not only for our students, but for Emplify Health by Bellin, and most importantly for the people of northeastern Wisconsin. To offer further context and perspective, it's now my pleasure to introduce the program's clinical supervisor, mental health counselor Kim Sandstrom of Emplify Health by Bellin.
Thank you, Alan. I am thrilled to be part of today's announcement. I have seen firsthand the challenges our future mental health therapists face in counseling in completing their education and training. And I know this program will make a difference for the therapists of tomorrow and, of course, those patients that we serve. I'd like to share a bit about a personal path to becoming a mental health therapist and how it relates to today's announcement. I was a returning adult student, meaning I was going to school full-time, working full-time, and had 3 young kids at home. Whether a traditional or a returning student, the story is often the same. The economic and logistical challenges of balancing work, school, and family obligations in a master's counseling program are considerable. It was certainly a challenge for me, and I know it remains a challenge for many of those students. As Chris shared, one of the biggest barriers to becoming a mental health therapist is finding practicum and internship opportunities, which are not paid and require hours that can equal a part-time to full-time job. As mentioned, therapists in training must complete their required 3,000 hours of supervised training after graduation. Supervisors are in short supply, and therapists in training often have to pay to get their supervision hours, adding another level of financial and logistical stress to this whole process. For too many promising therapists, the barriers become so great that they simply drop out. The Rush Mental Health Initiative removes those barriers, providing a clear path from education to licensure to employment. It really is a game changer for us. I am passionate about easing the way for the mental health professionals of tomorrow and thrilled that I will be working as the clinical supervisor for this program. This means I will work to place 25 students in areas throughout the Emplify Health by Bellin mental health system and will collaborate with my clinical colleagues to provide these students with a well-rounded experience so that they know their specialties when they join our team. I will also be their supervisor for those critical 3,000 hours after graduation, removing what can be an unsurmountable barrier for the therapist of tomorrow. I am so grateful to be able to do this work with this program. Thanks to this incredible partnership, the Rush Mental Health Initiative will erase those challenges and allow students to focus on their learning and their training without the extra stressors. And of course, none of this would be possible without the incredible generosity of the Richard J. Rush Foundation. To share a few words, it is now with great pleasure I welcome Sharon Rush to the podium.
Okay. Now, I had a few notes, but not many. Okay. Thanks a lot for everyone showing up today at the Rush Expo. It's a beautiful day, a little smoky though. Well, this is truly a momentous occasion. And I am thrilled to announce the Richard J. Rush Foundation is providing a transformative gift to make the Rush Mental Health Initiative reality. Today. Well, the need is great, as we just heard. From our young people to adults for all walks of life, and mental health is a challenge everywhere. It's in families, with everyone these people work with, undiagnosed and untreated mental health changes the lives of everyone around them. We know there is a way we can truly make a difference when it comes to addressing these problems. And Emplify Health and Marquette University have partnered to combine these offerings and expertise, and most importantly, the passion they have for making a difference when it comes to mental health is wonderful. I have trust and confidence in these partners, two partners that work together, and it will break down a lot of barriers and provide a direct path from education to employment. So I think this will be the start of something big. That's it.
Thank you, Sharon. That was such a great way to end our announcement. So that was perfect. So with that, the press conference concludes. We can open it up for questions. We also have folks that are happy to be available for one-on-one interviews after. No questions? Okay, perfect. We'll do interviews after then too. Thanks, everybody, and have a great rest of your day.